Okay, we're back live, and we're going to cover some different things this time. We're also going to take questions and answers, so be patient as it comes in to David. He will repeat your question, and we'll try our best to answer it for you. What we're going to do, for any of you that's out there, if you happen to have the training manual right here, the analysis training, there's some things that I think are real that we need to cover that will keep you out of trouble out there in the field when you're testing people, explaining to people things that you actually need to avoid saying, things that you surely don't need to diagnose. And now some of you out there as practitioners, you know a lot of this. You already know a lot of what's going on. But for you that are just becoming DPA techs, again, get you a DPA interpretive guide. You'll find it inside these folders right here, and you just go down the line and tell them what it says. Do not try to alter from that. Do not try to put your opinions in, because believe me, mine and your opinion doesn't really matter. Now, after maybe that you've done as many of these as I have, when I quit counting 4 years ago, I had already done over 16,000 of them, and I figure by now it's probably somewhere close to 20,000 tests that I've run. But what an unlicensed practitioner may or may not say, okay? This is people like myself that we don't have a license to practice medicine. So words that you need to stay away from. These words include cure, diagnose, prescribe, treat, and possibly even the word disease. When we are talking about cardiovascular disease, when we're out with it, now these things that I'm repeating to you today, you need to know as an operator. Things you don't need to tell the clients, okay? When we use the word cardiovascular disease, we may be implying they have this. What we want to do is we want to use words like this. Instead of the word cure, use alleviate, improve, correct, balance, or normalize a condition. So that gets you away from curing anybody. Instead of the word diagnose, use the word let me access, measure, or determine or evaluate a certain condition. Okay? Beware of the words you use. Make sure that you're aware of what you're saying. Don't ever tell anybody I prescribe to you CardioVibe. Okay? Use the word I even recommend or suggest that you take CardioVibe. These is to offer a way to alleviate or to help sustain help do away with a condition. Instead of the word treat, one may handle, work with, relieve, balance, normalize, correct, or remedy a condition. If the doctors say, well, I'm going to treat you, and that's exactly what they do. They treat a symptom, okay? They don't really treat the problem. Instead of the word disease, we want to refer to it as conditions, problems, imbalance. Instead of naming specific diseases, it is better to use simple, descriptive terms. For example, you might say, I see you have swollen joints, rather than I see you have arthritis. So what you want to do, and as I've learned over the years, what you want to do is to get them to tell you the issues or things that they're having rather than you trying to tell them, okay? A lot of times when I'm testing, and a lot of these things I'm telling you today as an operator, don't you go back out there and start jumping on the clients and telling them these things. I'm telling you what to look for. When you see on that test, you see a overload in the pH, and there's a good sign that you're looking down at a lady's ankles and they're swelled out over her shoes. You don't say, I see you're retaining fluid. You let them tell you that, okay? A good rule is not to promise anything except that you will do your best. Again, this is where the DPA interpretive guide comes in. You are repeating information, you are repeating knowledge that the medical people have put together with this machine to explain a test, get people's alertness. When it's all said and done, this machine is considered a early detection device, giving people a heads up as to what is beginning to take place in their bodies. And if they'll listen, then you can alter that, or you can help them to alter that. You may say that others have been helped, or that 80% have been helped, or some such phrase. Again, do not diagnose. In healthcare and other fields, words have powerful effects. Diagnose is telling you when a doctor, matter of fact, this past week, a friend of ours was diagnosed with cancer. Or the doctor, let me back up just a minute. The doctors told her they thought, because of the symptoms she was having, that she might have cancer without even going and running any tests. We don't want to do that. We don't want to alarm nobody. We don't want to get people upset with us. Diagnosis is the realm of the medical doctor. Let them do the diagnosing, and then we'll do what we have to do for there. Do not misrepresent yourself. Unfortunately, there's people out there that will take this machine, and they have in the past, and they will tell people what they want them to know. That client sitting across from you has no idea. So don't tell them something that's not reality. Don't use this machine to get people just to do things your way. Don't intimidate people with this machine. Tell them what it says. Again, I've been in places where we do health fairs, and people come in with alternative medicines or alternative products, and they come in a white coat. Do not do that. What you are signifying to clients then is that you're in the medical industry, and you're not. Do not wear a white coat to a screening or to a health fair. You dress as you normally would dress. Dress professionally, and don't try to misrepresent yourself. Do not use such words as law, medicine, psychology, unless you're licensed. Okay, if you're licensed, that's fine. You do whatever you. Don't get into fusses or arguments with other practitioners, other people that's out there doing other things. Matter of fact, you're going to have one of the only machines on the market that is FDA cleared. Okay, a lot of these guys out there has got machines that are, and they may be accurate. I'm not arguing with that point, but they've got machines that they're going to come in, they're going to do tests with that are not FDA cleared. Listen to what I'm saying. FDA cleared, not approved. The FDA does not approve machines. They clear them, signifying this machine is accurate as far as the FDA is concerned. So don't argue with people, well, my machine's better than yours, or this, that, and the other. Whatever you do, it is what it is. And people are going to judge you and your machine by the attitude and the way you conduct yourself, and the attitude you have will going about doing what you're doing. Never do you tell anybody to stop medications. I had this conversation coming up here with some people this morning, and the client told their practitioner, well, I've just thrown all my medicines away. That's their choice. You don't ever tell them to do that. Question. Okay, go ahead, David.
Could you... Okay. Could you explain what to tell a person who tests well and is on lots of medications?
Could I explain, if a person tests well and on a lot of medications, that's telling me the medications are doing their job. But remember, what they're doing is they are forcing the body to do what they want it to do. Remember this, that all those medications that they're taking to make their body perform in the long run is going to create some side effects. There's going to be some downfalls, even though at the point in time, a lot of times I go in and people, let's say for instance, somebody that's taking nitroglycerin, These are medications that do the same thing medically that arginine does naturally, and that is nitroglycerin explodes the arteries open, making the blood flow look better. Is it going to last? No, it's not. So therefore, what we do is going to go back in according, again, now you make sure when you explain this to somebody that you tell them this, according to the medical industry. According to what the medical industry has proven, that arginine goes back in, restores the walls of the artery to their natural health, doing it naturally rather than doing it medically. So just tell you people that the medicines are doing the job. I'm not, but if you'll read for you that's got televisions, watch the commercials. You'll have this much about what that medication does for you, and this much of what it does against you. And I hope that helps you out some. Okay. All right. I hope I had answered that question. Now then, let's get back to never tell anybody to quit taking their medications. First of all, even if they decide to stop a medication, you need to even advise them that not to stop doing it cold turkey, because that can cause the body to have trauma and can cause some bad side effects. So even if they're going, I've had people ask me, well, what about this and that? I said, well, if you're going to do it, and I don't have any control over you, if you're going to stop taking it, at least do yourself this favor, wean yourself off from it to where the body can eradicate it slowly. That way there's not any trauma left in the body, and that way we're kept clear of what we tell the people not to stop their medications on our word only, okay? Treat people kindly and fairly. And if you have been around this business long enough to know sometimes that gets hard, but sometimes you have to be just what you have to be, bite your tongue, go on about your business, because there's going to be people that come into you that won't have it any other way than medically. And that's their choice. You know, everybody's got the right to be wrong, okay? So that's their choice to do whatever they want to. Now then, understanding the cardiovascular system. I'm going to cover a little bit of those things that you need to know. We're not going to get, you've got this book, or most of you have. If you don't, then we have sent it to you email. You can print it down. But these are some things that we want you to know, that when you get out there with the public, and you're not going to be like I was in 2005 when I first went on the road with this machine. There was times that I looked like a total jerk because I didn't have any idea of what was there. Nobody was there to train us. We got all this over the years, and when this book was finally sent to me, it was a blessing in disguise. Understand the role of the endothelium. Remember this, and I have actually sat down in the office with cardiologists, discussed with them what this does. The endothelium, which is a very thin layer of cells in the interior of the artery, the inner lining of the artery, called the endothelium, that produces nitric oxide to keep the body functioning and to keep the arteries healthy, okay? When the endothelium is damaged, I'll never forget when the guy that trained us, one guy trained us on the machine. He was from San Diego, California. His name was Mark Cavanaugh, probably one of the smartest guys I've ever seen on this machine. And then later on, we had a guy come in and train us to be able to be trainers and certified us to train other people. But I won't never forget what Mark Cavanaugh said about the endothelium. He said the angioplasty, as you know it, or as you and I have talked about it, or some of us call it the rotor-rooter system of when they go in and do a heart catheterization or artery catheter, and they rotor-rooter the arteries out and flush the plaque out. And what he told us was that this was designed to be done every 3 to 4 years. Now, and this was a medical guy talking. This is what I'm repeating what he said. He said this was designed to be done every 3 to 4 years, and what he said was, you take it and you rotor-root that artery out, and you flush the plaque that you've cut out, and you flush it through the system, And if it don't stop the heart up, you're good to go. But what it also does is when they're rotor-rooting that, those little blades nicks the endothelium in the artery. And when it nicks that endothelium, the artery tells the brain, I'm injured. The brain sends cholesterol to that place where it's just cut, and therefore you have started another, preparing to have another rotor-rooter done in 3 to 4 years, okay? That's one thing that can be damaged. Another thing that can be damaged is simply by what we eat, chemicals we take in. It begins to kill the nitric oxide levels in our arterial system. One of the worst things in the world you can do, folks, is go down to McDonald's and eat what they fry in these saturated fats, and that sure does a lot of damage on your arterial system. We do know today that when the endothelium is healthy, it becomes like a piece of Teflon. It's slick. Nothing sticks to it. We've covered a little bit of this before. The next thing it does, if it becomes unhealthy, it becomes like Velcro. Now, you know, that's like you can take Velcro and stick it to anything and it'll hold part of it. So that's the same thing that's happening in your arteries. Cardiovascular issues, cardiovascular disease is a global epidemic. I did have it down one time to exactly how many. I think it's one person every 32nd dies from cardiovascular disease, and that is just unheard of. In our society, again, I think I already said this, 2,500 people per day die with cardiovascular disease. In our society, the black race, they have a little bit different makeup than the Caucasians do, and therefore there's an enzyme in their liver that don't convert things to the nitric oxide as much as it should, but by supplementing with arginine and nitric oxide, it converts it quicker, so they've got an upper hand on us as far as recovering is concerned. Cardiovascular disease is a leading cause of death in males and females in Western society. Again, let me say this, over 52% of those will be women this year. Let me give you a statistic that you need to know, because you're going to have people that come into where you're scanning, especially if you are scanning at a gym or a workout center or even a dance or wherever, that there are a lot of physical activities. Yoga, it doesn't matter what it is. If you ever get set up to get to scan in some of those places, they'll come in and they'll say, well, I do this and I do that, and I'm healthy. Don't let them convince you of that until they've run the test, because over 100,000, write that number down, 100,000 athletes die a year from sudden cardio death. The only ones you and I ever hear of is like the professional athletes that are practicing one evening and the next day they're dead. That happens usually. That's because of embolisms and where your arteries explode and whatever. And there's reasons for that. And if you've got a question about that, we'll be glad to. And then 30% of all deaths worldwide are because of cardiovascular disease. Deaths. This is something that's really intriguing to me. Cardiovascular deaths kill more than the next 9 diseases put together. If you stand before a crowd today and you ask the women especially, ma'am, what disease do you fear most? 99% of the time your answer will be breast cancer. Unfortunately, heart disease or cardiovascular disease kills more than cancer, unintentional injuries, chronic pulmonary disease, influenza, AIDS, suicide, homicide, and others. It's killing more than the next 9 put together. That includes AIDS, diabetes, anything you want to put together. So you think about that. We're fearful. The American Heart Association, and then we got the American Cancer Society that pushes hard to make you believe that they're the number one, but they're not. Refers to cardiovascular disease refers to diseases of the blood vessels, vascular arteries, and capillaries. Everybody knows what angina pain is, right? That's where there's pains going through your cardiovascular system, and it can actually lead into something else. Heart failure, stroke, peripheral vascular disease, chronic kidney disease, arteriosclerosis, atherosclerosis. These are some, let me tell you something, this is something men don't think about, and they should. Did you know that sexual dysfunction is also a marker for you having cardiovascular issues, okay? Now, what I'm fixing to tell you is it's not really a disease. These are risk factors for a disease, okay? Hypertension, that's not a disease, but it's a risk factor pointing toward cardiovascular disease. It can get into causing problems. High cholesterol, boy, there's a debate on that. It's everywhere you turn, the medical doctors want your good cholesterol levels down around 150, 140, 150. I don't agree with that, but that's neither here nor there. There's a book out there called the Cholesterol Hoax. Most doctors that I know that I've got confidence in, if the cholesterol is not over 200, then you're okay. Diabetes is not really considered a cardiovascular disease, but it's as close as you can get without being, because I know the doctor that trained me, the doctor that I followed for about 4 years, he treats all diabetics, and he would tell you that when he first started, that all his clients that would come into his office, that he wound up sending about 30% of them immediately to the cardiovascular or cardiologist to have some type of surgery. And over the years now that he has been treating his patients, and that's what he says, that he's been treating his patients with arginine, he now sends less than 0.5% of his clients to the cardiologist. Cigarette smoking, is that a disease? It's getting awful close, because it can have a lot of crazy side effects, especially on your cardiovascular disease, your lungs, and things like that. Obesity. That's another marker for cardiovascular disease. It's a marker, it's a factor, it's a risk factor. And all of us that are overweight, we fight that every day. Believe me, it's not an easy one to overcome. But the next one is just as important as a lot of the other things, is physical inactivity. In other words, you sit it on the couch every night, every day, and you don't ever get out and do any exercise, and then things begin to waste away. Poor kidney function. A lot of these things are hereditary, and that's what I'm fixing to get into. Family history. I think they say now that 25% of your problems may be hereditary. The other 75% are according to what you do with them and how you treat them. Men, after the 45 years of 45, women 65, in which that has become, in the last 10 years, that has dropped tremendously, okay? We had a young man just recently, had a man in our hometown this past week, just turned 65-year-old, dropped dead of a heart attack. We've had some that were 29-year-olds, some that's 30. That had a young lady, 39-year-old, 2 weeks ago, died from cardiovascular disease. So it don't have any respect of age. It's running rampant. Now, this is something, listen to what I'm fixing to say. Hispanics, black Americans are 5 times more likely to have cardiovascular disease than a normal person. The heart, from the time it starts beating till it quits, never rests. It's one of the only organs in the body that, you can go to bed at night, you lay down, and your lungs, your respiratory may slow down to a sleeping state. It may get some rest. But if that heart rests, then the rest of it's going to shut down also. So these are things that you need to know, that you need to be able to relay to the people. The heart functions as this. It beats approximately 100,000 times a day. 100,000 times a day. It supplies a blood vessel network of approximately 59,000 650 miles long, and pumps in excess of 10,500 quarts of blood around the body every single day. That's phenomenal how God put together this and works as good as it did as long as we take care of it. Okay? Between the beats, the aging ventricle fills with blood more slowly because of relaxing more slowly than it did when it was young. So you need to get this training manual out. You need to study it. You need to get the things that are important to you, that you can understand, things that you need to get other people to understand. Now then, I want to go to part 2 to try to understand the digital pulse wave analyzer. To understand the pulse wave analyzer and how it relates to arterial health. Screening risk factors by early detection of abnormal arterial wall function, identifying the arteriosclerosis and arterial aging, monitoring the effect of treatments for patients with hypertension and other cardiovascular disease, evaluating the efficiency of prescribed lifestyle modifications and medications. I don't know of anything out there right now that they prescribe, or the medical industry prescribes to anybody anymore, that don't have some type of devastating side effect. If it does this, then you got this other stuff that it does. Arterial compliance, elasticity. Remember when I was explaining the test a while ago, I said that I felt like that was one of the most important things about this test, is determining whether or not you have elasticity left in your arteries or not. Now, what does that mean? If the arteries are stretching, if they're complying with what they should do, if they're opening and closing like they should, your wrist. I'm gonna refer to what Dr. J. Joseph Pendergrass told us about if people's elasticity is where it should be. He said your risk of having a heart attack is a lot less than walking out on the highway and getting run over by a truck. So what is that saying? If you got plenty of elasticity, your risk of having a heart attack is very slow. So why do we need to get across to people that is important? Why do we need to keep it there? Because it can determine the longevity of our life. Arterial stiffness is a major cause of CVD, cardiovascular disease. How many of you over the last several years have heard of somebody that died from arteriosclerosis? Arteriosclerosis is nothing but hardening the arteries. Where the arteries get hard, when they get hard, then they become at risk factor of becoming an aneurysm then exploding. And if that aneurysm's in your brain, then you can just about kiss it goodbye. If it's in your aortic artery, then again you'll bleed out in just a few minutes, and life as you and I know it, they're over with. Increasing the risk of it increases the risk and heart attacks by failure and of also strokes. Unfortunately, we think that the machine that we got, a lot of you, this is maybe the first encounter you've ever had with it, but pulse wave technology is not a new thing on the market. Pulse wave technology has been around for over 130 years. I mean, that's what they've used even back many, many years ago to examine people and patients with, and it was part of a medical exam up as much as 130 years ago. In recent years, it's resurged, and doctors are using it now because another thing, too, that, and you know this as well as I do, doctors have got to the point to where they try to do as many tests as they can that's non-invasive, because people have got to where, just to be honest with you, people are scared for doctors. I know I could tell you a long horror story in my life, within me and my wife both, that had things done within 6 months of each other that like to cost both of us our life. The DPA can show the efficiency of lifestyle modifications such as diet, exercise, supplementation, and pharmaceutical drugs. Individuals respond to the powerful vision readout and can be a great motivator for preventative health. It is non-invasive. It takes a maximum of about 2 minutes to do the test, and then takes about 5 to 10 minutes to explain. My preference is this. I like to do group settings where I can scan everybody at one time, do one explanation, and then answer questions after that. That doesn't always fit your protocol. I have done many meetings at health food stores, chiropractors' offices, different places to where you have to scan one person at a time, do their test, explain it in privacy, and do that. I have done that as many as 43 times in one day. So that can get to be a chore. Remember, the DPA is a non-invasive procedure. Let's define pulse wave defined. As the heart beats, pressure and flow, pulse wave travel away from the heart and reflected back toward the heart from various locations in the arterial system. Remember me telling you it's considered a back tidal wave. Arterial stiffness occurs in varying rates in different people. In a large-scale study involving 3,075 healthy older people, those who had the highest pulse wave velocity were 3 times more likely to die of cardiovascular disease than those who had the lowest pulse wave velocity. That again is dictating whether or not you've got elasticity left in your arteries, whether they're stretching, whether they're opening up like they should. Why is that so important? Let's look at this just a minute. If you're feeding the body, if you're feeding anything, the more nutrients, the more blood, the more oxygen you get to your body, the better it's going to perform. Now, once your arteries, if they're pliable, if they're opening up, then the heart is able to supply the body with everything it needs, providing you're giving the body what it needs. Okay, such as supplements, such as protein, such as whatever kind of food you eat. You know, if you're eating too many fat stuff, too much grease, too much these things that's bad for you, then guess what? It's supplying the body with things it don't need. But once it begins to supply, the arteries are pliable, it supplies the body with everything it needs, the body stays healthy. As quick as those arteries become to where they're not opening right, they're not getting enough blood, they're not getting enough oxygen, you're not getting enough supplements, so therefore the body begins to deteriorate and begins to die, and ultimately that's the end. Aging and disease states associated with an increase in cardiovascular events alter the physical characteristics of blood vessel walls and impair the function of the arteries. Different things that these can happen. Again, an aneurysm can completely alter your lifestyle. I know people now that's got aneurysm. Matter of fact, we had a young man, younger than I am, about my age, I guess it was, come in the other day. He was a good friend of my sister's, and their families were close. He came in and told his children he had a severe headache. He was going to go lay down. After a while, he told them, said, "You might ought to take me to the doctor." When he got there, he had an aneurysm in the brain, and he didn't make it, unfortunately. The digital pulse wave analyzer, again, we want to cover that one more time with you as how to use it. When you put the probe on somebody's finger, make sure that the light is as close to being over the cuticle, the back of the fingernail as possible. After you've done enough of them, you kind of know how to gauge that. And these lights are LED lights. If they're not enabled, they're infrared. If they're not able to shine through that finger, and there will be some things, and this is something I was going to cover with you, and I kind of looked over it. The LED light is transmitted through the tissue of the sensor site, and the photodiode detects the changes in the amount of light absorbed by hemoglobin, which forms a PTG waveform. Now then, what will stop that from being able to perform the test? You're going to find, if you operate these things long enough, that you put the probe on somebody's hand, and unfortunately you're going to just get a squiggly waveform. What does that tell me? Several things. And I always, and I should have showed you this to start with, I always, in my machine, I carry a heat pad. I carry a heat pad you can plug up and warm the hands with. Why? Because if their hands are cold, it's not going to get into their fingers, and you're not going to be able to test them. That's just the bottom line. The second thing is if they can determine whether or not you get a good test on them. If they come into where I'm at, and this is always a good idea. Some of them may not want you to, but that's just the way. If they want to be tested, they have to. A real dark fingernail polish can stop it from testing. A black fingernail polish can stop it from testing. People that's got neuropathy, it won't get a good test, so therefore you've got to heat things up. It don't matter. Sometimes the fingernail polish, it don't matter how much you heat it up, it's not going to let you going to take it off. So when I first started, I'd take fingernail polish remover with me. Another thing that will cause you from quit getting a good test is this. If you got a gentleman, most times this is a men, and they'll come to scanning. They won't tell you about it, but they'll stop at McDonald's and they'll get a biscuit. Okay, when they eat that biscuit, all that residue from that biscuit will get on their skin, on their fingers, and it won't give you a good test. So what do? Take you some alcohol pads with you, clean their fingers, and you usually get it. Women, it's not the food that gets them, it's the lanolin and the hand lotions. And once you see this enough, you'll automatically be able to recognize it. Once you've done as many as I have, some of you, it's going to alarm you to start with, but don't get alarmed. Just get you some alcohol pads, clean their finger, go back and try to measure it. And when you do, it will let the light shine through, and that will give you a sufficient test. Again, when the little heart jumps up and starts beating, you know that everything's going fine. Now then, we must have a lot of people out there today that's pretty well satisfied with what we're doing, but I don't get many questions. But also, and I said a while ago, the principle of measurements, and some people are going to ask you this question: well, how do you know that the DPA machine is accurate? First of all, my answer to them is FDA cleared. My second answer to them, if they keep inquiring, is how do you know the EKG is accurate? They're both FDA cleared. They're both built by medical doctors or medical companies, and therefore they're FDA cleared. Again, how does the DPA work? The light shine through the hemoglobin, and that's what gives you the test that you're getting as an end result. The plethysmogram waveform, again, indicates how much elasticity left, how much not left. Now, I was going to say a while ago, and I want to finish this. Once you get to knowing, you get experienced on this machine, you're going to see that PTG go up, you're going to see it start back down, and you're going to see it echo back in. You're going to see it echo back toward the back wall. Well, right then you automatically know 95% of the time they have got high volumes of medications in their body. Okay, and unfortunately, some of these meds, it takes up to 30 days to get them out. So they just replenish them every day. I've got I won't call her name, but I got a young lady that's kin to us. That they got her on so many medications that she can't walk straight, she can't talk straight. She talks with a slur constantly, and I don't know why people can't understand that. That's not good for them. Now then, let's go to the next section and see what we're trying to do. Understand the operation of the machine. Again, as I went over with you to start with, please take this into, write it down. If you have to, you write down instructions how to set this machine up until you are satisfied you know what you're doing, how to do, because, ladies and gentlemen, you know what you paid for this machine. You know what it cost, and let me say this to you: you got out a lot better than I did 10 years ago. We paid $7,000 for them 10 years ago. So it's like everything in technology drops in price, but so you still got a lot of money in it. Now, one thing we didn't cover: where to get your paper. These are things that's important. Office supply. Office Max. Walmart used to carry it. I don't think they do anymore. But make sure when you go, it's called thermal fax paper. Get it and get the thickest they have. The real thin, and there's two reasons for this. The real thin, when the machine prints it, it don't print as dark, and it will fade quicker. Okay, now that's another thing too. When you run tests on people, you need to tell them either do one or two things. Make a copy of this, or put it in a dark envelope and put it up, because if they don't, again, I'm trying to teach you to tell you how to do things that won't catch you between a rock and a hard place like it did me. The first time I ever went and scanned, I believe I scanned 27 people at the first scanning I ever had in Pensacola, Florida. And I told them, I said, and I don't keep anything. I give it to the client. Here it is. And I said, bring this back with you when we do your retest, and let us compare our test. What somebody didn't tell me was that all this would fade away. So when those people began to come back in to bring their test back with me, there was nothing on the paper. It was had faded out. So I learned right quick to tell them to make a copy of it or put it in a dark place to where everything would be okay. Buy your paper. It's very inexpensive. I think 6 rolls is like $11. But get the thickest grade you can find. That way the printout is a lot deeper, a lot darker. This right here, unfortunately, is not the thicker. As you can tell, it's not real dark. And so you don't want that to happen to you. Understand your machine. Never, unless you're running a test and you need to stop and restart, the start and stop key you don't have to fool with. It's okay if you're running a test and you need to stop it. The print key, unless you're doing a setup to make sure the machine's functioning right, you never have to fool with that. Now there is a button on that machine. There's a little round button about this big. We'll need to go over that, I guess, again with you. But you can actually put in people's name, everything. But if you do that, it's going to take you 30 minutes to do a test, and you don't want to do that because people are not going to want to do that. And you set the different times that you want, how long it wants you to take it. But believe me, a 1-minute test is just as accurate as a 3-minute as you start doing this. All right, we're getting close to the end of this one. Special notes: patients, sex, height, weight, and blood pressure are not factored into the calculations for the measurement readings. There's indications once you do the test of what it can point toward, whether it can point toward hypertension, blood pressure. This right here is what they're telling you about the machine. Options of 1 to 10 minutes or 10-minute or continuous test. Best to test, if you go longer than 2 minutes, and the people get agitated, and that's going to affect their test too. If somebody comes in to be tested and they're a little bit hyper, set them down, test another couple for them, let them rest a little bit, let them get their conditions down. If they've had caffeine, then you need to know how to deal with that, because that's going to speed their heart rate up. Rest the left arm on the table, all the way up on the table. My suggestion to you is, we don't always do this, but you need to get you a soft, something, pillow soft or something to lay on their arm, because anything that's hard can affect the circulation into their arteries. Once they're resting on that, they need to sit still for a couple hours, and then the machine will print it out. And once it does, then the test is complete, and then you do the explaining again. If there's any more questions about what we covered, just send it in to David. Thank you. We'll return shortly.